I'm Dr. Michael Murray. I'm a naturopathic physician. I'm Director of Product Science and Innovation for Natural Factors, and I'm the author of over 30 books, including the best-selling book, The Encyclopedia of Natural Medicine. A heart disease usually is a result of dietary and lifestyle, and let's face it, there's a lot of people out there that aren't following the healthiest lifestyle or diet. Well, the most important supplement for supporting heart health is a good high-quality fish oil supplement. If someone has heart conditions such as a cardiomyopathy or congestive heart failure, high blood pressure, they should also consider utilizing Coenzyme Q10. Studies have shown that people with various heart disease have an increased need for this valuable nutrient that acts like a spark plug in our cells to give it more energy, and that's critical for helping that heartbeat every time. Coenzyme Q10 is a substance that normally we produce, but sometimes we don't produce enough. Its role in our body is similar to the role of a spark plug in our car's engine. We need it to create energy, and so when we don't make enough CoQ10, we don't create enough energy within our cells. That makes them more susceptible to damage. So low levels of CoQ10 are seen in people with any sort of heart disease, high cholesterol, high blood pressure. Low levels of CoQ10 are also linked to other degenerative diseases, particularly brain disorders like Alzheimer's disease and Parkinson's disease. So it's gaining a lot of attention as an anti-aging nutrient that is something that we actually make, but we need to sometimes take enough to bring it up to normal levels. Coenzyme Q10 works in our cells, specifically within our mitochondria, to help it produce energy. So without Coenzyme Q10, we wouldn't be able to produce any cellular energy, and that would mean our cells would cease to function. CoQ10 is necessary for the heart muscle to create energy, and without that energy, the heart muscle will not contract properly. Many times as people age, they stop producing sufficient levels of CoQ10, and this can lead to general lack of energy, but it can also lead to excessive damage to our cells, because if the cells aren't able to produce sufficient energy, they're not going to be able to protect themselves against damage. So you will see an acceleration of the aging process with low levels of CoQ10. CoQ10 should be supplemented by anyone who is taking a statin drug to lower their cholesterol, anyone who has an existing cardiovascular condition, high cholesterol, high blood pressure, any sort of heart issue. CoQ10 should be used in anyone who is showing excessive aging, specifically if they're showing signs of senility or dementia. This would indicate that their brain is not producing sufficient levels of energy as well as being protected, and Coenzyme Q10 may be able to help with both. In general, I would recommend, especially for someone taking a statin drug, that they supplement with 100 milligrams of Coenzyme Q10 twice a day. Coenzyme Q10 exists in two forms. One is an active form called UBIQUINOL, and the other is an inactive form called UBIQUINONE. Our body has the ability to convert the ubiquinone into a ubiquinol form, so we can get a great deal of benefit by taking ubiquinone versus taking ubiquinol, but there may be some situations where people would be better off taking the ubiquinol form, particularly in people who have not responded to the ubiquinone form. And we have seen this in a variety of people with congestive heart failure and other cardiovascular disorders. So there is some advantage to taking the ubiquinol form, but for most people the ubiquinone form works just fine. The key thing when taking a CoQ10 supplement is you take it in a soft gel form, and you take it with your largest meal or with a large meal, particularly one that has an amount of fat in it so that you can better absorb that Coenzyme Q10. Coenzyme Q10 can be very helpful in a variety of health conditions. Probably the most well-documented benefits of CoQ10 are in congestive heart failure. And typically what we see in these patients is improved heart function, and that can be measured clinically. It can also be experienced by the patient. What they will experience will be better tolerance to exercise, fewer bouts of shortness and breath, and higher energy levels.